First of all, generally, if we begin with the discourse on COVID 19, second wave deaths that are happening in India, and so most of the media reports are talking about that Indian healthcare system is on the verge of collapse. But if we see that how historically oppressed communities have always, for them, the system, healthcare, Indian healthcare system has always been collapsed. So there has not uh, much of a discourse in terms of that talks about the access of Dalit communities or other historically oppressed sections, and how they even uh, face difficulty in accessing the healthcare system. In Dalit Camera, Dr. Kafil Khan also talked about how Dalits are being treated, how untouchability is being practiced by the doctors within the hospital, and how he also uh, made this point that for the marginalized communities, healthcare system has never been accessible. So, and now this entire discourse, the deaths of people dying from COVID 19 have become such a important issue and became such a spectacle, because now elites and Indian middle class people are also dying. But if we see the poor people, the oppressed sections, people coming from the oppressed sections are dying from COVID 19 or from other healthcare crisis. It was also there in the first wave when people died uh, like anything, and there was not much of a hue and cry about it in the larger discourse that we now see in uh, the current time period. The other question is that the dominant discourse is also, of course, about those very distressing images, those very that we see, that how people died from shortage of oxygen, ventilators, uh, and medicines. But what about also the issue of mental health? That how this second wave of pandemic is affecting the mental health of the marginalized communities, for of the people coming from the oppressed sections, and what is the rate of suicide within these communities. And because one question that we talk is one aspect that we say talk about in the general level is that mental health care crisis and suicide is extremely common within the historically oppressed communities. But it is so common that when we see that suicides among the landless laborers, the suicide among the working class people coming from the Dalit communities, it is not even considered as a problem. That so that life anyway has does not have a value. And now what is happening to the people who have lost their jobs since the first lockdown happened, and who have been unemployed for almost more than a year, who are part of the urban poverty, who are part of the informal sector. So these questions remain unaddressed in this discourse on COVID-19 pandemic and the Indian healthcare crisis in general. So, my point of entry in this discourse is definitely someone who has the privilege of going accessing therapy. But I also come from a community. I identify myself as a Dalit queer person, and I have seen both in general and in particular level. General in terms of academia, where I have where is I'm professionally in academia, and where I have seen or have been witness to several student suicides who have been, uh, which are basically, one can say, as institutional murders of students from belonging to the oppressed sections based on their sexuality and caste, who have been pushed to commit suicide. If we talk about in 2013 of the suicide of Kashmiri Muslim student Mudassir Kamran in FLU, and or if we talk about the institutional murder of Rohit Vemula in 2016 in HCU, or if we talk about the suicide of J. Muthukrishnan in JNU in 2017, if I'm not wrong, and of course, like, and about like, so that has been one of the important reasons for me to talk about it, because all of these instances made me reflect about my own sexuality and my own Dalit identity and my own experience of facing caste discrimination and homophobia in the academia. And even in particular level, like, we also come from those families where we carry intergenerational trauma of, and of course the trauma of domestic violence in our in our domestic spaces. So that is one of the points of entry for me to talk about this. Intergenerational trauma is that how generally in our community, if we say that the oppression, the caste discrimination is structural and it is systemic, and how our parents, how our grandparents have also been like part of the urban poverty, have no access to healthcare, died from mental illness, died from several other illnesses like TB, or diabetes. So, and of course, also in our family, how like suicides have happened, or how basically there is so much of trauma and guilt and shame in family to even talk about someone who has committed suicide, that how the community, how the family felt helpless, or didn't do enough to support that individual. And so that kind of intergenerational trauma that I'm talking about, that how I see my mental health problem is not just a problem of me as an individual, but it is a problem that is being in my family also, because of my parents' intercaste marriage, because my dysfunctional family, because of the being the witness of domestic abuse, of being also being someone who has been raised, someone who struggled with one's own sexuality, and someone who have seen and being seeing the kind of problem that in terms of mental health or in terms of suicide that is ongoing in the family, but also someone who engages with this difficulty, that there is not much of a language even to address this problem of mental health, that how people in the family also can only approach to this problem in certain terms like economic, that that the economic conditions were not so good, so that's why it pushed an individual to commit suicide. But it is not just economic, but it is also structural and systemic conditions that have also been created in our communities, that not in our family and community in general, like not everyone is part of the upward social mobility. And so it's only in the context of me as a privileged individual who had the privilege of maybe having a support system in friends, in terms of friends from like in terms of allies, in terms of queer friends, or in terms of someone who has now probably can afford therapy. So so I'm so it is just not it's only in terms of that. Yeah, mental health, even like the moment we even utter this word, we think someone who is have become mad. So one is this perception, like, so one that you there is no such even awareness, like even if when I ask or tell my own family that they should seek mental health professionals, or even try to help in certain cases, but there was so much of reluctance to even seek help from mental health professionals and therapists, or so, so it's also because there is general perception that is created in our minds that the moment you say that it's a problem of mental health, it means you are mad. But maybe sometimes it's also important that maybe people in the family don't want to talk to someone in the family, but would like to talk to someone who they don't know in person, so that one doesn't feel that obligation, or don't feel judged of their vulnerability. So first point is that. Second is the what is the discourse of mental health in India. If we say that it is a elite discourse, it is like how many people can also afford a therapy session, which goes from, like, which is beyond 1000 rupees. So a daily livelihood of a person sometimes is just, very few like is very few. So how can we talk about the unaffordability of therapy? And the other aspect that lots of other dalit uh, Dalit individuals have talked about in the context of mental health uh, is that lots of therapists, like the therapy also and mental health also is field practitioners, are also caste blind. So they also don't come from the uh, those caste locations of historical oppressed communities. So they also face difficulties in terms of addressing the problem of mental health that a Dalit individual is facing. So so there is that problem of recognition also, that how to address this problem, where caste and other factors are very central in terms of creating the mental health crisis, or in a particular individual or in a particular community. So and within the family, that is why, like, they like our families generally only access health care when it comes to, like, some uh, physical injury, or when there is some other condition like diabetes or something like that, so which is affecting us in a physical way. But when it comes to psychosocial problems, so there is no uh, place where one can have a conversation that of therapy is also, or uh, going to a psychiatrist can also be important uh, part of seeking part of healthcare. So one thing is that there is already, when we are in academia, as Dalit students come to the academia. So one that is like one context as an example that I'm giving to you, that people think that okay, you have reached to this position and you have reached to the institution of higher education now, or and of course, using reservation. So you have, so now what do you want? You should just study, you should focus on your study, you should, there is you have entered in uh, a level playing field kind of a place, right? But we also then come to know that how professors are all savarna, all upper caste. The way they treat a upper caste student is different from the way they treat a Dalit student. The way discrimination, humiliation, and shaming of the Dalit student also function at various levels, even in the classroom and outside the classroom, right? So then that, of course, also affects the performance of an individual, right? So one is that it is these things that are operating in terms of family, in terms of in terms of studies, in terms of relationships, in terms of friendships. So you see that you get you encounter various uh, layers of discrimination, shaming, humiliation, uh, in all these places. Then the another important part is that yeah, you should just focus. It's the will. It's on about all about the will of the student. That if you have a strong will, then you can uh, like cope up to these pressures. You can be a meritorious. You have to focus on the studies, but uh, these factors play a very important role in also affecting the confidence of the students, also in terms of affecting the confidence of the individual. So we just cannot remain blind to this, that we are someone who is devoid of emotions or devoid of the not acknowledging these particular factors that are playing in terms of affecting our performance or productivity, right? So the one factor is that, and of course, even in terms of your uh, private lives, like whether in my context, I think my sexuality and my own family, like it becomes very also important factor in terms of affecting my mental health. So like so how that also, like it's not that you have just entered in a place where the private doesn't affect your also the personal life, or it's like you have just been totally removed from all the social or all the structural uh, functionings and like discriminations, right? So it doesn't work like that, right? So there is also both the personal and the professional. And as we are talking about that, how caste is, and caste, homophobia, all kinds of discrimination is systemic and structural. So it is not outside the professional, personal, in any other sphere. So it plays some kind of a role in terms of affecting our productivity. Thing is that with the most of the movements, it's generally it's focused about on fighting larger battles, right? If we talk about coming from a student activism perspective, it's always like more focused about fighting larger battles with the university administration, or with about all those issues. For it is about not just fighting the university administration but the state, and in general. So so of course in these movements we don't have the scope for conversation. It's also that the movement has to put a united face against these opposing forces, that we, and to also project themselves that we are strong, we are we are also strongly resisting to your oppression, right? So, and in this whole narrative of being strong, resilient all the time, vulnerabilities remain unanswered. Like, so, and we see that even in farmers' protests, we see that people are committing suicide, right? Writing suicide notes and committing suicide. And it's just that, and farmer suicide is, and the suicide among the landless laborers is something which is there for a long time. And generally there is also been a larger discourse on farmer suicides and suicides of landless dalits, right? So it's just that now it is also happening at the site of the protest. So then, so that is the important part, that of course the more time goes, and in terms of sustaining a struggle, the more challenging it also becomes in terms of maintaining the mental health of an individual, or the entire community that who are participating in the struggle. But we do see some individual struggles, such as Blue Dawn, that addresses the problem of Dalit Bahujan communities and its an intersection of mental health. And then I know a friend of mine, uh, Neeraj Kumar, who is also uh, has and their initiative of Unsound. So, but these are just, of course, there is a long way to go in terms of addressing this question. Yeah. So, martyrdom is definitely a very, yeah, it's in the farmers' protest, when we see that there is also now a website which talks about, which basically focuses on how many deaths that have taken place in the site of the protest, and they all are called as martyrs, and their act of suicide is seen as the sacrifice for the struggle. So of course, and yes, we have seen this in the Telangana struggle also, where uh, so many young people committed suicide. And so one thing is the cultural question, that there is this whole uh, culture of martyr making, and in Punjab it becomes a very long trajectory, coming from Sikh tradition, coming from the left tradition, coming from the anti-colonial tradition. And so it's the intersection of all those legacies that create a martyr, or that, where the recognition is given to an individual uh, sacrifice as the act of martyrdom. I'm sure I don't know much about the context of Telangana, but I think it's generally a cultural thing to see that how in a movement individual sacrifice is considered as a act of martyrdom. But yes, it totally negates the problem of mental health, and but also that the problem is the mental health is a very urban centric discourse, and even when it comes to an urban centric, and it is also very much discourse limited only in terms of upper middle class or elites, or people who have reached, are in the context of academia and activism, so they would be knowing about, okay, there are mental health, and there are, still there are some individuals who are giving us or giving counseling, free counseling. So there are now helplines that are set up, even during, especially during COVID times. But I'm have seen even during anti-CA agitation, when my previous workplace, Jamia Millia Islamia, was brutally attacked by the state, and how again that whole violent uh, attack on the university again created both, of course, not just a physical injury, but also the whole trauma to the entire university community, whether it is a faculty or a student, right? And students who were participating in the anti-CA NRC protests. So uh, so that time I have also seen that the concerned mental health professionals, and collectives have set up counseling, and like services, like, to approach them. So it is, we do see in certain initiatives, but it is still very much limited to a certain circle, right, of university activism, or that sort of arena. But when I, like, come from like, I for me as an individual also, it's so difficult to talk about mental health when it comes to my family. So just imagine, like, and I'm a second generation educated Dalit queer person. And if even in my family it is so difficult, just imagine those who are first generation uh, 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 students, or people coming from the historically oppressed communities, or many people who are not even in the urban locations, or in the rural locations. So how do we even address to this problem, right? So, and that is why then, the only way it becomes uh, one of the forms to address this is to make, call it as a martyrdom, or yeah. But I'm sure there are other ways also in the communities, even in the rural areas, where I don't know how people talk or communicate to each other and help each other. But as I have said in uh, a earlier also, while talking about caste and mental health, that in the university spaces I do feel that listening circles, or having a support group of uh, individuals who are committed to the cause of anti-caste, or the individuals who are coming from, Dalit, Bahujan, Adivasi locations, so how they can help each other. Like, for me, let me tell you my example. Like, I faced a instance of caste discrimination in a CSSC, which, where basically it's like in Calcutta, which is like totally Bengali Bhadralok dominated educational institution, but where all many of the academics also made their careers theorizing about the subalterns. But when I faced the instance of caste discrimination, I didn't even know how to whom to approach. There was no Dalit faculty, there was no other Dalit student, and there was no other any institution where I can even register my complaint against the professor who discriminated me. So, but when I came to FLU for my PhD, that was the first time I saw a Dalit students organization in the form of Damsa, where I first saw the Dalit students in the position of leadership, where first time people are talking about caste not in the language of trauma, but in the language of dignity and self-respect, right? So that made a very important, very huge impact on me in terms of my own recognition and self-identification as a Dalit, in talking to become more comfortable with my Dalit self, right? So that way, I'm saying that the Dalit student groups and Dalit individuals in the academic spaces, if because there is a certain judgment and shame when you talk about your mental health problem to a non-Dalit student, or there is high chances that you'll be judged. So but if you can talk with your own community people, if you can find form listening circles and support groups, and then work in with other organizations which are queer affirmative, which who are at least who dedicated to the caste of anti-caste discourse. So then we can, if we form those kinds of alliances, then at least we can at least help each other out, at least this generation, that to deal with this pandemic of caste and in mental health. Yeah.